Hello and welcome back to the Deep Dive. Today we're taking a look at two really big and honestly quite complex areas in healthcare, things that are really shaping society right now. We've gone through quite a bit of material, different sources, and our mission, like always, is to pull out those key insights for you so you can get up to speed fast. And joining me to help unpack all of this is our expert.
Hi there. Yeah, ready to dive in. These are definitely important topics to connect.
Okay, so let's jump right in. The first thing is, well, it feels like a huge shift in UK healthcare. Just last week, June 20th, 2025, Parliament passed the Terminally Ill Adults Bill, the End of Life Bill, and the vote was pretty tight, wasn't it? 314 to 291.
That's right. Yeah, quite close.
So what's the core of this bill? What does it actually mean?
Well, fundamentally, it allows adults in England and Wales who are mentally competent and critically diagnosed with terminal illness with 6 months or less to live. It allows them to seek medical help to end their life.
Okay.
But there are some pretty strict safeguards. You need approval from two doctors and a multidisciplinary panel.
A panel. What does that involve?
Yeah, so that's a social worker, a legal expert, and a psychiatrist all weighing in. And another really key point, the person has to take the medication themselves. Self-administration is crucial.
Right. That sounds like it puts a lot of control back with the patient. So what were the main arguments pushing this forward? Why now?
Well, the people supporting it really focus on dignity and autonomy
Mm.
for patients facing terminal illness. You know, the idea of allowing them to avoid suffering they feel is unnecessary. And, I mean, it's not happening in a vacuum. We see similar laws in places like Canada, some U.S. states. So there's a bit of a global trend towards this kind of patient choice at the end of life.
But obviously, a close vote like that means there were strong arguments against it, too. I heard the removal of high court approval was a big sticking point.
Absolutely. That was a major point of contention.
What were the main worries there?
Opponents raised serious concerns. Things like, could vulnerable people be pressured, maybe subtly, maybe not so subtly? Is palliative care good enough across the board to be a real alternative? And then there are the moral questions for doctors and healthcare staff involved. It's a heavy responsibility. Although it's worth remembering that YouGov poll, it showed something like 73% public support, which is quite significant.
Yeah, that is high. So it's past the Commons. What happens next? When might we see this actually implemented?
Okay, so next it goes to the House of Lords. They'll review it, maybe suggest amendments. If it gets through there, the timeline for actual implementation is probably within about 4 years. So we could be looking at maybe 2029.
Okay, 2029, right. So shifting gears now, but staying within healthcare, let's talk about something impacting the very start of life. NHS maternity services. There have been some really worrying headlines, and now Health Secretary Wes Streeting has announced a rapid national investigation. What triggered that?
Yeah, it's really quite urgent. This investigation comes directly off the back of some truly damning reports. Reports showing systemic failures. The most prominent one, probably, is the Auckenden Review. It looked into over 1,600 cases at just one NHS trust, Shrewsbury and Telford.
Wow, 1,600 cases.
Yeah, and it found really deep-seated problems. Things like not enough staff, poor communication between teams, and really tragically a lack of compassionate care, all leading to preventable harm, even deaths of mothers and babies.
That's just devastating. So what's the goal of this new national investigation? What are they hoping to find or fix?
The main aims are, first, transparency for the families affected, giving them answers, and second, crucially, driving real, urgent improvements in safety and the quality of care across the country. They'll be looking specifically at units that seem to be underperforming, but also trying to identify those systemic problems that might affect the whole NHS. We should see the findings by December 2025.
And you mentioned staffing. How big a factor is that in these problems?
It's huge. The Royal College of Midwives estimates there's a shortfall of at least 2,500 midwives right now. That kind of shortage leads directly to staff burnout, immense pressure, and that inevitably impacts the quality and safety of care families receive.
Yeah, you can see the domino effect.
Exactly. And something else that's really stark and has to be addressed are the inequalities. Black women in the UK are still 4 times more likely to die during pregnancy or childbirth than white women. 4 times.
That's shocking. 4 times.
It's a critical systemic failure that this investigation absolutely has to tackle head-on.
It's interesting hearing these two issues side by side. Assisted dying at the end of life, maternity care at the beginning. On the surface, they seem worlds apart. But do they tell us something together about the bigger picture of healthcare right now? What's the connection?
I think they really do. What connects them, I think, is how they both shine a light On the absolute importance of patient autonomy, yes, but also compassionate, equitable care. And maybe more fundamentally, they highlight the immense pressures the NHS is under. Resource challenges, staffing shortages, making sure services are safe consistently everywhere. It's about the system's ability to deliver truly individualized, dignified care when it's stretched so thin, whether that's at the very end of life or the very beginning.
So it's not just about specific policies, but the system's overall health, its capacity.
Precisely. It forces us to look at how we support people through vulnerability and at crucial life moments within the structures we have.
So thinking practically then, what needs to happen? What are the steps to address these challenges that seem to cut across different areas of care?
Well, there's no single magic bullet, obviously. But key things include serious investment in the workforce, not just recruiting, but retaining skilled staff like midwives. We also need really robust oversight, mechanisms that can spot problems early and act decisively before things escalate like they did in Shrewsbury and Telford. And, critically, listen to communities, engaging properly to understand what different groups need, especially those facing disparities. It has to be patient-centered, truly.
Investing in people, better oversight, and really listening makes sense.
Yeah, policymakers have to put that patient-centered approach right at the heart of it.
Thank you. That really helps connect the dots between these two vital areas. And thank you, our listener, for joining us for this deep dive today. As you think about this, maybe consider, what do these discussions about choices at the end of life and the care provided at the start of life tell us about where compassion and responsibility need to head in our healthcare system? Something to think about. Stay informed, take care, and we'll talk again soon.